morning, students. Today we will discuss about wings, the second part of thorax of insect. Myself, Dr. Ashok Siroya, Department of Zoology, SPC Government College, Ajmer. In basic external insect anatomy, we earlier discussed about the three pair of legs on prothorax, mesothorax, and metathorax. Wings are also present on mesothorax and metathorax. Insects have evolved many variations of the wings. There are two pair of wings. First pair is on mesothorax and second pair is on wings venation is a commonly used taxonomic character, especially at the family species level. There are means of venation from the insect wings, which are used as a taxonomic character. Membranous wings are thin and more or less transparent. These are thin and transparent wings. This type of wing is found among the Odonata and Europterata. Odonata, and Europtera. We see the typical insect wing. A typical insect wing is triangular with three margins and three angles. The three margin and the three angles. Where are the three margins? This is a costal margin. This is first costal margin, second apical margin, third anal or inner margin. Anal or inner margin. If we make the differentiation, the apical region, apical margin or outer margin is here from this part, and anal margin is, you can underline this part, and the three angles is on this wing, typical wing, the humeral angle. This is the humeral angle. Apical or outer angle. This is outer angle or apical angle. And the anal angle or tornus. This is anal angle or tornus. If we take a knot on this angle, this is the humeral angle. The apical angle lies here, and the anal angle lies here. Humeral angle between the body wall and costal margin. This is costal margin, and this is body wall. Apical or outer angle between costal and apical margin. Costal margin and apical margin. This is the angle. The anal angle or torus between apical and anal margin. Apical and anal margin. Apical and anal. Areas, regions of the wing. The region containing the bulk of the veins in front of the clavicle furrow is called reniz. This part where all venation or bulk of veins are present is known as reniz. Cross veins, longitudinal veins, different type of veins are there. Then reniz. The area behind the clavicle furrow. This is clavicle furrow. It's called clavus. Clavicle furrow. This is clavicle furrow. After renizium, there are different rows and folds. This is venal fold, this is jugal fold, and this is clavicle fold. Area behind the clavicle furrow is known as clavus, except in hind wings, in which this area is greatly expanded and known as venous. In hind wing, this is expanded and known as venous. Means between clavicle fold and venal fold, this is venous. And this is clavus. And after this is jugum. Finally, the jugum is cut off by the jugal fold. This is jugal fold. This part is jugum. Pterostigma. Pterostigma is a pigmented spot present on the anterior margin of the wing. This is present on both pair of wings in odonata. This is a special character of odonata, and on the forewings of Arnoptera, Sophoptera, Mecoptera, and Neuroptera. Both pair of wings in odonata is a special character of odonata. The identification of odonata. In odonata, it is believed to reduce the wing flutter. This stigmata, this pterostigma or pigmented spot, reduce the wing flutter during gliding and thereby increase the gliding speed. So it is a adaptation to glide or to glide speedily. Wings are very thin, broad leaf-like structure, strengthened, strengthened by a number of hollow, narrow tubular structure called veins. There are different type of veins present on the wings. Arrangements of veins on the wing surface is known as wing venation, which consists of two types of veins. The arrangement of these veins on the wing is called wing venation, and the wing venation have two types of veins. First is longitudinal veins, extended from base to the wings of margin. This is the base, this is the margin. From here to, from base to margin, this is longitudinal veins. Wings to the margin, they may be convex or concave. They may be convex or concave. Shape may be like this or may be like cross veins that interlink the longitudinal veins. Two longitudinal veins interlinked by cross veins. These are the cross veins. They are joint longitudinal veins. There are different names here. Longitudinal veins, costa, subcosta, radius, media, cubitus, anal, jugal, inner. Name are given on the basis of their location.